Okay, hi everyone. Welcome to the live training today. I am so excited to talk to you about what really lights me up in terms of chronic pain management and my philosophy. But first, I just want to introduce myself to anyone who's new. My name is Dr. Anna Redmond. I'm a chronic pain educator, a trained clinical psychologist with a specialty in pain. I also work as a pain coach. I have a program for women with chronic pain, and I have over a decade of experience working with individuals suffering from long-standing pain and that physical impact of stress on their bodies. And I've transitioned away from the conventional model of practice to gain some flexibility and also to reach more women. So I'm so glad that you're here and participating with me today. If you see me looking to the side, I'm usually tracking with my notes. I prepare for these. I want to be prepared for you and give you as much value as I can. It'll be pretty informal, just talking to you a bit about like who I am, how did I get to this place of, working with people who have chronic pain, and how did I get to the place of having the philosophy that I have? And just to help you get to know me a little bit, I'm an action-oriented self-improver, just like you. I would even say that at times in my life, I would identify as a perfectionist, a high achiever. I super duper thrive on the excitement of a busy life, but I also thrive on that downtime to balance it out. I have gratitude for small moments. Any moment that forces me to be present and stand strong on my own 2 feet. And, I'm grateful for everyday moments of healing that contribute to the person that I am. I think you'll find that this group, these trainings, my education, my content, that it's a reflection of who I am at my core. I'm a pragmatist. I'm a professional overthinker. I'm a planner. I have a need for routine. I have a passion for organizing the chaos, which I think the women in my Breaking Through Pain group would agree that there's definitely an approach to pain that involves planning and organizing the chaos. I'm an imperfect but deeply loyal mother and wife. I have 2 small children and a husband who I love deeply. And I'm a general work in progress, just like all of you. We are always a work in progress, right? But I'm also someone who believes that very strongly every woman with chronic pain deserves a certain amount of education on pain, on their pain. That's who I am. That's what I'm about. And if you want to know what I mean by this, just stick around, grab that coffee that maybe you poured 4 hours ago and haven't had a chance to enjoy. So I'm just going to roll out some education here today. I think it's helpful and I talk about my story and my approach, the interventions I like to use with chronic pain. I talk about those in one of my earliest live trainings about the pain trifecta and my story. So go ahead and review that if you think you would enjoy it. I'll tell a little bit about my story today, because I think it's good for you guys to know, like, how did I go from just being a student in psychology, right, to being a pain psychologist, a chronic pain educator, and even someone with my own experience with chronic pain, and how did I land on my values that are represented in my pain philosophy? And I would say that I've always been the type of person who's curious about the root of why things are happening, especially on a behavioral and an emotional level. I've always been a persistent self-improver. I'm always striving to do better, to understand myself better. And I also enjoy interacting with all kinds of people, and I was always told that I should be in a social field. I've always felt that I was sensitive emotionally and physically, or being told that I was sensitive, usually as if it's something bad. And this is something that I view about myself now as a really incredible strength and a positive attribute. I believe there's an important place in the world for highly sensitive people and for empaths, but it really took me a long time to like that aspect of myself. All of that is to say that it probably didn't surprise most people close to me when I decided to pursue a degree in psychology. And as my life went on, my experiences in early adulthood kind of gave me this data that supported this idea that my body was sensitive. And I've always been so in tune with all of the experiences, all of the sensations, everything happening in my body all the time. And at that time, I was getting headaches. I was always looking for ways to reduce muscle pain. I was always dealing with fatigue. And doctors would have said to me multiple times if I ask about a symptom, well, some people are just more sensitive than others. And like I said, I was always one of those people. So I basically combined this with a curiosity about the mind-body relationship, and this really fueled my interest in health psychology and eventually pain psychology. And once I finished graduate school and I got my doctorate in clinical psychology, I really sought out experiences that would help me develop an expertise in health, pain management, and then I went on to become board certified in biofeedback. Up until 2019, I worked at a hospital as the director of an interdisciplinary pain rehabilitation program. And there I worked alongside a physical and an occupational therapist. We together built a program from the ground up, and we ran this program in a completely collaborative and integrated way. We literally taught every bit of that program all together. It was amazing. I learned so much from them, and it really expanded the way I was learning and understanding and teaching pain. And as part of that role, I spent a considerable amount of time providing education around chronic pain, both for patients but also for staff at the hospital, on local and national calls, and in the community. And this role really became a strong foundation for, kind of this experience that I had listening to people suffering from longstanding pain. And I think it also informed sort of this pain, so it informed that trifecta of how I approach pain that I talked about in that other live training. But I think it also really informed my pain philosophy. Now, the other thing that informed how I think about pain and my values around pain is that I've had my own experience with it. I have. And I think my encounter with chronic pain was like a lot of people's in some ways, or at least how they start out. And just quickly, I'll give you sort of the highlights of that story. I went to my primary care doctor. I told her I had neck pain for 6 months and it wouldn't go away. She ordered x-rays and an MRI, and I went to her office for the results. And I always kind of talk about how she pulls out the nearest spine model, tells me I have a bulging disc. She explains what that is, and she gave me all of the reasons why I might be having this bulging disc or this neck pain, repeated whiplash when I was trying to learn how to snowboard, posture at work, certain weak muscles in my body, faulty movements. And she referred me to a physical therapist. And beyond that, I saw several physicians as well. And, luckily, I kind of felt like I knew enough about managing chronic pain. I'm a trained pain psychologist, so that I could start implementing some coping skills on my own. And, I was a high achiever, right? I will do anything my doctors tell me to do. I'm a good patient. My personality really drove me to feel kind of compelled to heal, but in a perfectionistic kind of way, which wasn't necessarily good. And historically, I've always approached challenges with hard work, and results have always reliably followed that. And that just did not work with my pain. I felt like nothing was helping. Starting with medical appointments and physical therapy really seemed to make sense to me at the time. I needed to learn my diagnosis and fix it, right? But in hindsight, it really wasn't enough. And I knew intuitively, but also just from my training, that my experience was entering chronic territory. I knew this was a totally different game that I was starting to play, right? And I could feel my body become more sensitive. I was already thinking about my pain often, fearing my diagnosis, avoiding my favorite activities. I'm just going to basically stop here in my story to make 2 points. The first point is that this whole scenario about presenting to our provider's office, getting those tests, the diagnosis, the mechanical issues, what's happening in the periphery of our body, without acknowledgement of anything else. And what's happening here when that happens is that the biomedical or the physical model is set in place. So we learn in this model that the presence of pain is due to old or ongoing tissue damage and something is wrong physically. And the provider will focus on addressing, the bad disc or whatever it is. And then a patient will experience the hope that the treatment or the fix will make it go away. And I'll also say that when they do this, when providers do this and they can't find evidence of what's causing your pain, then it sort of automatically somehow falls into this other category of it's psychological pain. And I'll get to that a little bit later. But I think people start to feel like, well, what does that mean then? You think I'm making this up or it's not real. So I think it can have a really difficult impact on someone for whom they can't find damage on a scan, neither of which are any less real pain. And as I've talked to people with chronic pain, I come to learn that they have spent years of going to appointments, labs, tests, interventions, procedures, surgeries, medicine, physical therapy, often with disappointing results. And the funny thing is, I did this too, but I knew better. I was a pain psychologist. I educated patients and providers all over the hospital that I worked at this idea I was trying to teach them. We should not be treating chronic pain from a solely biological or biomedical standpoint because pain, especially after having it for years, isn't just physical, it's multidimensional. It's impacted by a number of biological, psychological, and social factors. But I was in a culture where the driving force was find the physical problem and treat it with the physical solution. So I got swept away in that right off the bat. The second point I want to make about my experience and this whole scenario is that the journey of chronic pain can begin at different times for different people. Maybe that's the onset of an injury. Maybe it's a particularly stressful phase of adulthood. Maybe it's in childhood alongside adverse or traumatic experiences. Maybe it's a combination of some or all of these things. All of these pain experiences are real. And in hindsight, I think a lot of things contributed to my pain personally. The sensitivity I mentioned earlier, a tendency toward perfectionism and people pleasing, and honestly, these characteristics just failing me at the job where I was working when my pain started. And while I worked with some of the most wonderful and talented people I'll probably ever encounter, this was also a job that often felt toxic professionally, interpersonally, and it felt really challenging. In addition, I was working at a hospital at the peak of the opioid and chronic pain epidemics as they were really colliding, and providers were identifying patients on high dose opioids and weaning them off and telling them, okay, now we want you to go see the psychologist. And honestly, that just really pissed people off. We weren't providing pain psychology in an environment that truly included it in the day-to-day culture of treating pain. On paper, we did, but in reality, we had so many minds to change. And so I'm sharing sort of this scenario of when my pain started to show up and become chronic, just to share that I think, maybe there was an injury, who knows. There were these other stressors at this particular point in my life where the roots that I believe now were the roots to my pain becoming chronic. At the time, I couldn't see the link. I really thought I was functioning well, considering how stressful my job environment was. But I think we all know, sort of generally, that the nervous system can only stay turned on for so long before it gets burned out. And then we start to see a cycle of chronic symptoms, particularly pain, set in. So, honestly, I think what followed for me, and I think this is similar to the experiences of others, when I heard those words bulging disc from my primary care doctor as she's holding a spine model, bringing up my x rays and my MRI. And she even said, if it doesn't get better with physical therapy, I might have you see a surgeon. I was so awash in fear. I couldn't get this image out of my mind that she shows me on the x-ray. I thought I would never get better and that I'd only get worse with age. And I really was jumping to the worst case scenarios. And I'm telling you that because it can happen to anyone. I should be the most prepared as a pain psychologist not to jump to the worst case scenarios. But I think it was just too hard. The initial appointment instilled so much fear in me about my body, and I wish I had known better, but I didn't. And I think this is why. Because just like my patients, I looked to the medical system for answers and a medical fix because that's what we do, right? That's what we get in the culture of treating pain. Honestly, what happened was that no one ever asked me about like the stressors in my life, the other things going on. Was I burned out? Was I fearing the things that I enjoyed? Was I avoiding things? Did I feel anxious about my diagnosis? The whole conversation was focused on the disc bulge. And here's what they didn't tell me. Most cases involving, and I'm talking like 80 to 90% of bulging or herniated discs will heal within 2 to 4 months. What if she had told me that? Also, disc bulges are the most common finding seen on imaging. So really, yes, there might be a disc bulge there, but this could be incidental and not even necessarily a reason for my pain. But guess what? Now I'll never forget that I have a disc bulge in my neck. Did it go away? I don't know. And disc bulges are found commonly in people with and without neck pain. Some people who are known to have disc bulges have never experienced neck pain. In fact, 40% of asymptomatic patients my age have disc bulges. And just to go on a little digression here, what's even crazier is that years later, I recently had an appointment, this was literally like a year ago, at a well-respected hospital to see a pain physician. And it wasn't because I was experiencing any significant pain. My goal was just to be connected with a physical therapist who could help me reach some of my movement goals, learning how to surf and get stronger and not flare up my pain from years ago. Whether or not it would have happened, I don't know, but I wanted support through this, right? Before I could even see the doctor, they asked me to go to an x-ray room, and they wanted x-rays before knowing anything about my symptoms for her to review when she saw me. And the people pleaser in me kind of followed the technician to the room. And once I processed what was happening, I told them I'd actually prefer not to get an x-ray. I didn't have any red flag symptoms, just straight up stable chronic pain. And I didn't want to know about any more potentially incidental findings. And I was really surprised at this absurdly outdated practice at this highly regarded institution. Anyway, I've had all these experiences of my own. I've had experiences through listening to what other people have gone through and the words and language that are shared with them and the way those are felt in their body, the way it impacts how they cope. Most importantly, I think the fear that's often instilled in appointments by often very well-intentioned providers, but there's so much fear when it comes to chronic pain, and I sort of made it my mission to kind of decrease some of that fear, educate on pain in a way that feels less, it makes you less afraid, but also helps you feel more empowered. And so that's just kind of a little bit of background information about sort of where I come from and where some of my philosophies come from that I'll share with you now. There are 5 pieces to my pain philosophy, and I'll talk briefly through each one. These are values, these are things that are very meaningful to me. This is what I base every bit of content and live training and approach in my program. I base it all around this philosophy that I've developed over a decade of working with individuals who have chronic pain. So the first is that your pain is real. The second is that pain is more than just mechanical. The third is that pain is an alarm system. The fourth is that we are bioplastic. And the fifth is that words are powerful. So let's start with the first one. I believe your pain is real. Has anyone said that to you ever? Because I'll say it to you now. I believe your pain is real. It doesn't matter where it started. All pain is real. And to me, so much of what makes up someone's chronic pain management are the experiences they've had along the way, right? And some of these experiences that I've heard, let's say your scans revealed that nothing was amiss in your body, so you start to question whether you imagined it. Super common. The cause of your pain was treated and it didn't go away, so now you're mortified that your doctors or other people think it's psychosomatic or made up. You should have benefited from those treatments. Super common. There are no signs of ongoing damage. There's nothing that can be done from a medical standpoint, so you accept a referral to a psychologist, which has only been offered to you now, feeling like you must be damaged emotionally in some way, or maybe you didn't accept the referral because you're not depressed, you're in pain. Also super common. Your symptoms feel like a mystery. They never quite fall into a clean diagnosis, so you keep seeking any test, procedure, or appointment that might legitimize your pain. Super common. But what is happening here? One of the biggest contributors to these experiences many women have is that chronic pain has been erroneously labeled a physical or biomedical problem. And by biomedical, I'm referring to physical, mechanical, anatomical. And for many years, scientific medicine focused on identifying and addressing the physical causes and fixes of pain. And this makes sense as a place to start because we feel like pain lives in our bodies. This is not the most updated way to approach pain, and in fact it's actually 400 years old, and it's still the one that's most commonly used by medical health professionals. And this approach, this biomedical approach, when it's used alone for chronic pain, is outdated, it's unacceptable, and we know that it doesn't address all of the issues of chronic pain. And strangely, you can dig into literature and see decades of research acknowledging that pain is biopsychosocial. And yet for decades, when providers talk about, teach, and treat patients, it's often still treated as only a physical problem with biomedical solutions, pill after pill, procedure after procedure. What I want you to understand, and I have, I have a ton of education around this, and there's so much more to it, but I want you to understand today that if you've had any experiences similar to this, anything like this, anything difficult, feeling like no one thought your pain is real, I want you to know that this is not your fault. This is not your fault. Okay? Your pain is real. The International Association for the Study of Pain acknowledges that all pain is real. And any provider who doesn't isn't up to date. All pain is real, and all pain is biopsychosocial, meaning it's impacted by biological, psychological, and social factors. So say this with me. You can say it to yourself if you feel silly saying it out loud. Just say, my pain is real. My pain is personal. My pain is multidimensional. Okay? And you deserve treatment for your pain that acknowledges this first and foremost. Okay, so the second So your pain is real is the first one. The second one is that pain is more than just mechanical. Okay, so do any of these terms sound familiar? You have wear and tear, you have muscle imbalance, your hips are out of alignment, your MRI is showing us that you have degenerative changes, or you have a bulging disc, or anything similar to that. You have bone on bone. Identifying a mechanical dysfunction in the body is how the medical system has long tried to approach the problem of chronic pain, kind of like find the problem area, fix the part, pain will subside. And this can work so well, especially with things like acute pain, like a broken arm, but it's a very simplistic view of chronic pain. It's outdated when it's used alone, and it causes distress for the person experiencing chronic pain. And this is because our mind-body vehicle, this is a mind-body vehicle, it's not a car. Addressing pain is more complex than visiting your mechanic for a fix or a part replacement. So if we even pick one of the statements that I said before, your MRI revealed degenerative changes. Did you know that two people with similar MRIs, both with signs of arthritis or degenerative changes, could have vastly different experiences? So one person could be playing at the height of their basketball career, and the other could be just totally down for the count because they have severe knee pain. So what accounts for this difference in experience, even though the x-ray shows the same thing? Context, the brain, thoughts, emotions, experiences, so many things, everything and anything that makes us unique. And remember that biopsychosocial model I brought up earlier, the idea that pain exists in the overlap of biological, psychological, and social factors. They are all so important when trying to understand your pain. And so I am not poo-pooing the biological part of the biomedical part. It's important, and it encompasses a lot, including tissue damage that you might have, genetic predispositions, anatomical issues, nutrition, sleep, movement, exercise, um, system dysfunction, dysregulation. I don't think you'll find one pain provider or educator that denies that the biomedical domain of understanding pain is important. But we have to understand that pain isn't just this. Again, it lies in the overlap between many biological, psychological, and social factors. So if you are trying to fix just one piece of the picture, the physical part with a medication or a procedure, you're only treating 1/3 of the problem because we're not acknowledging any psychological or social or contextual factors that could be keeping your pain going, right? So then we're not treating the whole picture of pain. And I think the best thing about thinking about your pain as biopsychosocial is that you kind of have a long list of possible factors that you can personally identify as impacting your pain experience positively or negatively. And when we limit our perspective of pain to biological, mechanical, biomedical, we just don't get that. So this is the second building block of my philosophy, is that pain is more than just mechanical. So instead of thinking of your body as a car with broken parts, think about your body as a car with 4 flat tires. One tool, one approach is only going to pump up one tire full of air. It will still render you unable to drive or go anywhere. And so think about that. Have any of your past treatments alone given you more than 25% long-term relief? Because your pain is unique and multifaceted. And so the combination of factors that impact you, treatments, therapies, or tools, is also going to be multifaceted and unique to you, and your treatment and the approach from your provider should be reflecting this. The next piece of my pain philosophy is that pain is an alarm system. So what if I told you that pain was actually good for you? You're rolling your eyes. I know, everybody rolls their eyes when I say that. It's fine. Pain, though, is a wonderful and protective internal alarm system in our body that's based on our evolutionary need to survive. It alerts us to danger, it motivates us to take action and stay safe. It keeps us from using our arm when it's broken. It helps us reflexively remove our hand from the hot pan that's burning it. And it pushes us to take action when we accidentally cut ourselves with a knife. And we used to think of pain as a measure of tissue damage, but now again, we think of it as more complex, but it's also this sophisticated protective mechanism. And so I want you to think of your pain as an alarm system that's made up primarily of the brain, the spinal cord, the nerves, sensory receptors, and danger detectors. And these danger detectors are distributed all over our body and act as the eyes of the brain, whose job it is to protect us. And those danger detectors send messages from an affected area in your body through the spinal cord to the brain. And then your brain, using all of the information available to it, past experiences, memories, mood, emotions, trust, feelings of safety, input from our senses, degree of threat, your brain using this information will produce pain if it thinks we need to be protected. I recently thought about this once when I was driving through a neighborhood in my town and someone's home motion sensor light was going off. And my car was literally so far from their home, it did not make sense. I couldn't see how that was helpful as an alarm system for them. And so think of your pain alarm system like a motion sensor light. The light goes off to warn you of movement near your home, a potential intruder to get your attention. And similarly, pain will go off to let you know that something is wrong. But what if those motion sensor lights were on a setting that was too sensitive or too reactive, like my neighbor? They might go off when an animal walked by or when someone was driving on your street for 20, that or 23 feet away, but there's no intruder or risk of damage to your home, just an annoying light that keeps going off and on all night long. And this happens enough nights in a row that you make a note to yourself to fix it tomorrow. And a sensitive alarm doesn't really care what it's interrupting. A relaxing moment to yourself, a quiet bath, a good book, a party. Pain is like an alarm system, and sometimes pain is like an alarm system that goes off too soon. When pain's been present for a long time, the alarm system can become faulty, sensitive, and too reactive as well. And the threshold for danger becomes lower, and the alarm repeatedly sounds too soon. And there are so many factors that can contribute to an extra sensitive alarm system. What it means is that we need to reduce the level of threat that can come in through all these different avenues and engage in behaviors that regulate the nervous system to kind of recalibrate it, to reset that alarm system. So if you're thinking that, hey, maybe my pain alarm system has become more sensitive over the years, know that it's not your fault. It happens to me, it happens to your providers, it happens to everyone. It's basically just your brain and your nervous system getting too much practice at the wrong thing, all in an effort to protect you. And the good news is that you can recalibrate your pain alarm system. So again, this is the third building block of my pain philosophy. Pain is like an alarm system and it can be recalibrated. So think of all the things that make your nervous system feel safe. This could be any type of self-care, a recovery activity, activities that bring joy. There are so many ways you can recalibrate your nervous system. And this is something that I spend a lot of time creating a foundation for in my Breaking Through Pain program. Okay, the fourth element of my pain philosophy is that we are bioplastic. So what do I mean by that? Well, I like to think that, in my opinion, some of the most powerful words in the world of medicine and physical ailments are, you are going to be okay. But most individuals with chronic pain have never heard those words. And in fact, when most people see a pain provider, they're given lessons on anatomy or biomechanics. And there's actually some studies that indicate that this has limited efficacy and can actually increase fear. Further, using degenerative terms are actually associated with a poor prognosis. And even though pain is a normal part of the human experience, the tissue isn't always the issue. And again, the strategy used by so many people doesn't even address the main issue in the room, which is pain, right? Or a newer word, bioplasticity. So this term was popularized by the incredible pain experts from the NOI group. They're the group David Butler and Lorimer Moseley wrote Explain Pain, so that's where this all comes from. This is where physical therapists are really leading the charge on some of the pain science here. But bioplasticity acknowledges that all of the systems in our body have the potential to change, from our skin to our immune system to our muscles to our brain. And the idea of these systems being plastic can kind of be likened to the idea of plastic material being melted, recycled, molded into new shapes. And with new demands placed on it repeatedly, our body systems can adapt, grow, and change. And so a great example of bioplastic potential is when we see recovery after stroke. After a stroke, with repeated practice and movement, a person can gain their motor function back on the injured side because of the brain's unique ability to grow and make new connections in response to new learning or behavioral changes. So basically, bioplasticity, and this is how they describe it, it has a dark side and a bright side. The dark side is, it develops because our body systems just get more and more practiced at keeping us safe. So nerves that convey danger messages to our brain and brain cells involved in making pain become more sensitive, and our emotional, cognitive, endocrine, and autonomic coping systems are being turned up and dialed up for too long. So this can kind of make us as a whole a bit more edgy, more sensitive. And this process, like at first, is normal. It's just our body systems trying to get better at protecting us. But it's not helpful, right? It's that sensitive alarm system that's no longer helpful. But neuroplasticity, bioplasticity is the process by which that happens. But the bright side of bioplasticity really can give us hope, regardless of a pain condition, regardless of duration. And this is why I really hate when, in provider visits, like we really limit what people's recovery can be when we don't actually know, right? Regardless of a condition or duration, we just know from bioplasticity that protective systems in our brain and our body can be dialed down and even turned off with new experiences, with different ways of thinking, talking, behaving, and moving. And knowing that we can gain from education about pain, what it is, how it works, how it's created in the body, and about the bioplastic potential of our body systems is so powerful. And Professor Lorimer Moseley has a great quote on this that says, bioplasticity got you into this situation, and bioplasticity can get you out again. And so this is something that we focus on a lot in my pain program, because again, we're using everyday moments to find that bright side of bioplasticity and do some brain retraining and recalibrating of that protective system. So the fourth, and this is another thing I'm going to have you say with me, right? The fourth bit of my pain philosophy is, I am bioplastic and I will be okay. All right? Okay, the very last piece, the fifth and final building block of my pain philosophy, and I've so enjoyed telling you guys about this today, um, is just the power of words. I'm really big on language. And, as I was saying, I was trained as a clinical psychologist, and I went on to work with so many patients who had long histories of pain conditions. And I think the best skill that was instilled in me during my training was this ability to listen and hear the patients I worked with. I wanted every person to feel heard. I wanted them to feel cared for, but I also knew I couldn't fix every patient. But over time, I really came to appreciate the power of their words, the significance of their stories, the power of their providers' pain explanations, and even my words, how I understood their described experience and how I was going to help them. Every day was different, and as I became more experienced, I didn't really have a script for how I talk to people about their pain, because there isn't one. There's no specific combination of words that I could apply to every person in pain. There's too much uniqueness, uncertainty, and years of experience for them. And so instead, I would search for their unique story in their conversations with me, in their chart, and their unique story can be found if you listen hard enough. This is what I learned. And I was always seeking a better way to talk about their pain with them, using their words, their framework, their experience, their story. And I'm sure some of my past colleagues will laugh at this, but I wrote very detailed notes when I would do initial consults with people, because I found, they were just full of important notations of how the individual was describing their pain and how it happened and their experiences with the medical system. So like, I couldn't waste any of those words. When you're trying to hear and understand the nuance of someone's pain story, all of the words and all of the language is important. And this is because words carry so much meaning. And beyond meaning, again, it all comes back to this link between the mind and the body. And when someone shares their pain story out loud, this story the words, they become neurological events. They become part of a circuitry where the brain transforms them into knowledge, thoughts, opinions, and maybe even danger signals for their alarm system. When we think about words in a conventional medical setting, or I guess anywhere, the way we deliver words holds a lot of power. And if we aren't careful, when we deliver unhelpful language, it can have a really terrible effect. It can add distress, fear, threat, and it can really fuel a cycle of chronic pain. And so I guess I always felt that a critical task for me as a pain psychologist was to help other providers kind of shift their beliefs to the bigger patient picture, their words to more neutral, more rational explanations of pain, but also to help the people I work with rephrase their inner monologue, which was influenced so heavily by the very triggering pain explanations they had heard from their providers over the years. And I'm going to share these with you, and I did not make these up. These are, I've heard them so many times. You will end up in a wheelchair. You will have to learn to live with the pain. This is the worst I've ever seen. You've blown your knee. This is bone on bone. Your disc is bulging, herniated, ruptured. Degenerative disc disease will eat away at your spine. So this is what people are telling me over the years of having chronic pain. And over, I reminded them, your pain is real. Your pain is more than just mechanical. Pain is an alarm system. We are bioplastic, and words are powerful. And so even just 10 minutes of neutral, rational, carefully chosen education can change everything for someone who's had pain for years. And most people aren't getting it from their providers. And I know that helping people understand their pain can have such an impact on their engagement in other treatments, in coping skills that actually help them build up their life and in their recovery. And I truly feel that education provides you the power to take the next steps in managing your pain. The onus for so long has been in the hands of your medical providers. But I think based on the most up-to-date information about pain, when we put the onus in your hands, but we armor you with everything you need, this is where we see people actually recover. The people who are getting better are following this new science. And so if any of this piques your interest, I do want you to know that I have a coaching program for women with chronic pain. It's called Breaking Through Pain. It's a high achievers 3-month accelerator for pain recovery. And you will find that my pain philosophy is present. It's threaded throughout the program. And the program aims to give you the support you need in your everyday life to apply what you are learning to your unique life, because your life and your pain is unlike anyone else's. The education that will help dial down the threat and then empower you with a new perspective to approach your pain differently. And all of the information, education, and support you need to keep this going, because your recovery is possible. Everyone's recovery may look different. How long it takes to get there may look different, but it can always be accelerated by the right education, and it is possible to find a life that is bigger than your pain. If any of this sounded interesting to you, or you're really looking for this kind of support, please don't hesitate to reach out. We can just have a phone call. It's a no pressure call just to talk about your pain experience and see how I can help, see if it makes sense to work together. But at the very least, I always feel like I can offer something that's helpful. I'm genuinely here to support you. If you're interested in having a call with me, just comment chat on this post in the comment box, or you can message me in Messenger or DMs, whatever you want to call it. Those are always open for you. So thank you for showing up today. If anyone has any questions, you're welcome to put them in the chat. I don't see any, just a hello from someone. Thank you so much for being here and writing this to say hi. And even if you're watching the replay, feel free to say hi. Let me know where you're listening from, and which part of the philosophy resonated the most for you. I think I'd love to hear which piece resonated the most. Someone's asking what the book was called. I think the book you're referring to is, they actually have it, and well, the group is called the NOI group. And if you go to your website, they have many amazing books. Thank you so much, everyone, for coming. Again, whether you're watching live or watching the replay, I would be honored to have the experience of guiding you through your pain. So don't hesitate to reach out if that's something that you're looking for. All right, everyone, have a great day. I will talk to you soon.